The joint Australian-New Zealand conference was held in Brisbane in 2019. One presentation within the conference was given by Dr. Erin Godecke. She's reporting a randomised controlled trial of intensive aphasia therapy after acute stroke, with data collected from both Australia and New Zealand. She's going to tell us a bit about the study now.
Thanks, Corrie. The VERSE trial was the first international aphasia trial, so we're very proud to present the results at the conference this year. What we did was want to look at a question around intensity. So there's lots of intervention trials in rats and animal recovery in stroke that indicates that early intervention is effective and more effective in that early phase of recovery, and that intensive intervention helps recovery across the board. So what we thought we would do is apply that theory to aphasia recovery. And we did a randomised controlled trial around 17 sites in Australia and New Zealand, in 40 subacute care sites, because we followed people across their recovery period. And we asked a question around intensity. So if we provided more intense intervention in that very early recovery period, starting within the first 2 weeks of their stroke, would that elicit better results and better communication at 12 and 26 weeks after their stroke? What we did was randomise these people into groups, one of 3 groups. They either received standard usual care at the standard rate, or they received extra usual care done at 45 to 60 minutes 5 times a week, or they received a prescribed intervention. And we followed these people through to 12 weeks after their stroke and looked at how much intervention these people got. So our study was very well designed, and we found that through our fidelity monitoring that 88% of those people randomised to that intensive intervention got the intervention we prescribed. And at 12 weeks our results were really surprising, because what we showed was that those that got a smaller amount of intervention, those that got 9.5 hours of therapy as opposed to nearly 23 hours of therapy, did better. And so that flies in the face of the theories that we were thinking would enhance spontaneous recovery. And actually what we are believing the data is showing us is that our early intensive intervention doesn't fit the models of neurorecovery. It's more akin to lining up with natural learning models. So we're going back to the drawing board and working out where we fit. It's a really important study in the international field at the moment, because it's one to say that actually our results, it's important to start therapy early, but it's also important not to do too much, because actually there will be a sweet spot of therapy where too much therapy is of no more benefit than doing a standard 2 to 3 times a week for about 50 minutes a session.
Such important findings. We'll look forward to seeing results of what comes next at future SPA conferences. Thank you so much, Erin.
Thanks.